we treated dosing. Yesterday we treated dosing of solid formulation and liquid formulations. Under liquid formulation, we treated injections, and we also treated suspensions. So today we want to take a look at dosing that is based on units. There are some drugs you will see, instead of seeing milligram or ml, what you see there is you will see something like unit or IU. So we call this type of dosing doses based on units. Now, there are some drugs, especially large biological molecules. For large biological molecules, they are measured, they are expressed in units instead of weight. They use units to express, to quantify them instead of weight. So, such large, why they use units is because these molecules are large, so that it's difficult to purify them. You know, in the drug discovery, drug production, you purify from the source. These large biological molecules are difficult to do what? To purify. That's why they are measured in units instead of weight, because they are large. So, to be able to do that, it is more accurate to use how they act, their biological activity, to quantify them. It is better to use their biological activities, and their biological activities is expressed is expressed in units. Now, as example of such biological molecules, we have your hormones. We have hormone product, we have insulin, and some anti-infective drugs. If you want, they're like even vitamins, yes. You see vitamins, they'll tell you that they sort of like vitamin A. Vitamin A, you see something like 500,000 units. Even nystatin is an anti-infective. Nystatin is also in units. After this class, if you have if you like, you can go online or go to any pharmacy close to you. Even you can even go to a pharmacy there in the school. Get a packet of vitamin A, look at it, you see that it is in units. Even what is it called again? Even no, what is in IU? Sorry, IU. Even though some can still be in mg, but some anti-infective like nystatin is a unit. You see something like 500,000 units of nystatin. Then even insulin is in IU. I don't know if you're opportuned, if you've been opportune to see insulin packet or insulin syringe is in IU. So these are large biological molecules. Now, based on this little introduction, I want us to solve a question based on this unit. So we have, let's look at example 7.11. Read it, Christopher.
Iyo.
Hello?
Hello, sir.
I said, this person knocking, doesn't he know that you are having lectures? Huh?
I don't know. It's my course mate.
Why is he not in this class? Why is he's not attending the class?
I don't know for them.
Continue. Read example 7.11.
Okay, sir.
All right.
7.11.
Yeah.
Nystatin has a recommended oral dose for adults of 5,000 units every 6 hours for the treatment of candidiasis. A suspension containing 100,000 units per ml is available. What is the total daily dose of nystatin for an adult, and what quantity of suspension will be required for 5 days of treatment?
Good. Now, remember I told you that nystatin is an anti-infective. It's antifungal. It's used for fungal, to treat fungal infection, which candidiasis is one of them. So nystatin is used to treat candidiasis. So as you can see now, the strength there is in unit. We are told that they recommend for adult 500,000 units of nystatin every 6 hours for the treatment of candidiasis. Now, a suspension containing 100,000 units per ml is available. What is the total daily dose of nystatin for the adult, and the quantity of suspension that will be required for 5 days of the treatment? Now, let me ask the same question I used to ask again. Between 500,000 units and 100,000 units per ml, which of them is the dose, and which of them is the strength?
The 500,000 units is the dose.
Okay.
Why the 100,000 units per ml is the
strength?
Is
the strength. Good. Because that is the one that is available. That is how the company presented it. Good. Now.
Yes, sir.
Now the first question says that we should calculate the total daily dose of nystatin for adult. Total daily dose of nystatin for adult. Total daily dose of nystatin for adults. Now, let's go back to the prescription. It says 500,000 units every 6 hours. So every 6 hours, 500,000 units. So what it implies is that, what do you think, how many units is required for a day now? If the patient is to take 500,000 units every 6 hours, how many times a day is every 6 hours? How many times in a day?
It's 4 times a day.
So that means how many units of the nystatin should be taken in a day?
It's 4 times 500,000.
Which is what? Two million.
2 million units.
Good. So the daily dose of nystatin is 2 million units. That is the answer to the first. That is the answer to the first question. So the total daily dose of nystatin is 2 million units. Now the second part of the question says, what quantity of suspension will be required for 5 days? Now, remember we are told that the one that's available is 100,000 units per ml. So what it means is that 1 ml contains what? 100,000 units, right? 1 ml contains what? 100,000 units. So, but the total daily dose is how many million? 2 million, right? Right?
Yes, sir.
So if one male contains 100,000 units, how many ml will contain that 2 million units?
20 mil.
So 20 ml will contain what? 2 million what? Units, right?
2 million units.
Good.
Yes, sir.
But this is number of ml per day, true or false?
Yes.
That 20 ml is the number of ml in a day. So,
yes, sir.
So what is the quantity that how many ml now will be used for 5 days?
100 mil.
Good. So 100 ml of the suspension is required for 5 days. Is it clear?
Yes, sir.
Any question here?
No, sir.
All right, let's continue. Now let's look at example under example here. Example 7.12. Read it.
A type of vitamin oral drops contains 5,000 units per ml of vitamin A. There are 40 drops per ml. How many drops will provide a child with 750 units of vitamin A?
Good. This type of question, you look at it critically. You look at this question critically before you can solve. Don't just rush, jump into it and start solving. The question says, a type of vitamin oral drops contains 5,000 units per ml of vitamin A. There are 40 drops per ml. How many drops will provide a child with 750 units of vitamin A? There are three quantities that were given to us. We have 5,000 units per ml. We have 40 drops per ml. We have 750 units. Which of these is the dose? Which of these is the dose?
The dose. So I think it's 750 units.
Good. 750 units is the dose. Now which of these is the strength?
5,000 units per ml.
Good. 5,000 units per ml. So what is 40 drops per ml then? What is 40 drops per ml? What does it mean?
That each meal that is made up of that 5,000 units contains 40 drops.
You just say
40 drops will deliver.
You just a conversion factor, trying to let you know that 1 ml is equivalent to 40 what? Drops. Am I communicating? This one is a general thing that 1 ml is what? 40 what drops. That's what you're trying. Is a conversion factor. So you use this conversion factor to solve this question. Now you were told, look at how the question ended. The question is not asking you, instead of asking you how many ml that will deliver the 750 units, it's not asking you how many what? Drops. So to solve this type of question, what you do is this. Since you know that the strength is 5,000 units per ml, right? If the strength is 5,000, if the strength is 5,000 units per ml of vitamin A, and 1 ml is the sentinel with 40 what? Drops. That means the 40 drops will contain 5,000 units. True or false?
True.
Good. That means 40 drops will contain 5,000 units. So if 40 drops contains 5,000 units, how 750 units will be contained in how many drops? What's the answer? Solve it. If 40 drops, that is if 5,000 units is contained in 40 drops, so how many 750 units will be contained in how many drops? Just set a proportion. 40 drops is for 5,000 units. Then X drop is for 750 units. You cross multiply 750 units times 40 drops all over 5,000.
6 drops.
So 6 drops. So 6 drops will deliver 750 units. Is it clear? Is it clear? Any question?
No, sir.
Good. Now let's continue. Now, sometimes, when I was mentioning biological molecules, I mentioned vitamins, hormones, and some anti-infectives that I express as units. Some may be international unit, IU. Some may be ordinary unit. Now, but vitamin A, there is this conversion factor for vitamin A. If you want to convert vitamin A from IU to microgram, there is this conversion factor. If you want to convert vitamin A from IU to microgram, or from microgram to what? IU. So for vitamin A, 1 IU is equal to 0.344 micrograms. So please note this important conversion factor. For vitamin A, 1 IU is equal to 0.344 micrograms. So you can use that if you want to check the weight of vitamin A. You can use that is presented to you in IU. You can use this conversion factor to convert it to what? Microgram. 1 IU is equal to 0.344 microgram. It's for vitamin A, not for all the drugs. So now the same thing with vitamin D. Another name for vitamin D is ergocalciferol. Ergocalciferol is another name for vitamin D. While another name is for vitamin A is retinol. In short form is retinyl acetate. In the short form, are we together?
Yes, sir.
Are we together? Good. In the short form,
yes, sir.
In the short form is retinyl acetate. Now, for vitamin D, ergocalciferol. If you want to convert vitamin D in IU from IU to microgram, 40 IU of vitamin D is equivalent to 1 microgram. 40 IU of vitamin D is equivalent to 1 microgram. So please note these two important conversion factors for vitamin A and vitamin D. It's very important. So based on that, we'll now solve another question. Based on that, we'll solve another question. That is example 7.13. Read it. Read it.
Hello, sir.
Read example 7.13.
Okay.
Have you been following
Product A contains...
Were you following what I was saying since?
Yes, sir.
All right. I have read example 7.13.
Product A contains 8 milligram of vitamin A and 400 IU of ergocalciferol, and product B contains 2,500 IU of vitamin A and 10 microgram of vitamin D. Which product contains the most vitamins?
Okay. Now, they gave us two products, product A and product B. They are saying that product A contains 8 milligram of vitamin A in the form of retinyl acetate and the 400 IU of ergocalciferol, while product B contains 2,500 IU of vitamin A and 10 micrograms of ergocalciferol, that is vitamin D. So this question is simple. You just to use the conversion factor I told you about to convert each of them. After conversion now, you then check the one that actually contains more vitamin. Am I communicating? Now, both vitamin D and vitamin A are vitamins, but we want to check the one that has we want to check the one that has more vitamins. So let's start with product A. Product A contains 8 milligrams of vitamin A. If you check, vitamin A in product A is 8 milligrams. But if you go to product B, vitamin A there is in 2,500 IU. You can convert any of them. The most important thing is to make sure that they are in the same unit. If you are comparing vitamin A in product A with vitamin A in product B, they must be in the same unit. Am I communicating? The same way, if you are comparing vitamin D in product A, it must be in the same unit with vitamin D in product B before you can compare the two of them. So now, if you look at product A, vitamin A in product A is 8 milligrams. Please, if you're not following, call my attention, please.
Yes, sir.
If you look at product A, vitamin A in product A is 8 milligrams. While in product B is 2,500 IU. Is 2,500 IU. So we can decide to convert that 8 milligram to IU so that it will be in the same unit with the one in product B. So remember what I told you, what I said about conversion factor of vitamin A. We will say that vitamin A, if you want to convert vitamin A from, we will say that if you want to convert vitamin A from IU to microgram, what do? You see that for vitamin A, how many IU is equivalent to 0.344 microgram? 1 IU. 1 IU of vitamin A is equivalent to what? 0.344 microgram. Are we together? Are we together? Hello? 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 Christopher? Hello? All right, let's continue. Where did we stop? Huh? Where did you stop?
Hello, sir.
Where did we stop?
Hello.